Did you know that obesity, which belongs to the category of metabolic and endocrine disorders, can negatively affect your life and act as a detriment to your life? If you're over 45, this conversation becomes even more critical because the challenges and risks associated with obesity compound significantly as we age. Hello everyone, and welcome back to our channel. I'm here today to talk about something that affects nearly half of all American adults, obesity. But I'm not here to shame anyone or make you feel bad about your weight. Instead, I want to have an honest, informative conversation about what obesity really means, especially for those of us who are 45 and older, and most importantly, what we can do about it. Let's start with the basics. What exactly is obesity? The World Health Organization defines obesity as abnormal or excessive fat accumulation that presents a risk to health. Now, most of us are familiar with BMI. That's body mass index, which is calculated by dividing your weight in kilograms by your height in meters squared. Obesity is classified as having a BMI of 30 or higher. But here's where it gets interesting. There are actually 3 classes of obesity. Class 1 ranges from 30 to 34.9 BMI. Class 2 is 35 to 39.9. And Class 3, which is sometimes called severe or morbid obesity, is 40 and above. These classifications aren't just numbers. They help doctors determine the best treatment approach for each individual. Now, here's something fascinating that many people don't know. Different populations around the world use different BMI thresholds. For example, in Japan, obesity is classified at a BMI of just 25. Not 30. Why? Because research shows that Japanese individuals tend to develop obesity-related health problems at lower BMI values compared to Western populations. This tells us that obesity isn't just about a number on a scale. It's about how excess weight affects your individual health. The Obesity Medicine Association has given us perhaps the most comprehensive definition. They describe obesity as a chronic, relapsing, multifactorial, neurobehavioral disease. That's a mouthful, but what it means is that obesity is a complex medical condition that affects multiple body systems, involves both physical and behavioral components, and tends to be a long-term challenge that may come and go throughout a person's life. Now, let's talk about why this matters so much more when you're over 45. As we age, our bodies change in ways that make us more vulnerable to the effects of obesity. Think about it. Your metabolism naturally slows down. You might not be as active as you once were, and your body composition changes, often losing muscle mass while gaining fat. The cardiovascular risks are particularly concerning for adults over 45. With obesity, obesity acts as an independent risk factor for heart failure, heart attacks, and strokes. It increases your risk of high blood pressure and can even affect how well blood pressure medications work for you. The relationship between BMI and heart health follows what researchers call a U-shaped pattern, both very low and very high. BMI values can increase cardiovascular risks, but the sweet spot is somewhere in the middle. Here's what's happening inside your body when you carry excess weight. Obesity promotes enlargement of the heart chambers, encourages plaque formation in your blood vessels, and increases your risk of developing serious conditions like atrial fibrillation. and abdominal aortic aneurysms. These changes compound the normal age-related changes happening to your cardiovascular system, creating what scientists call a synergistic effect that significantly elevates your health risks. But it's not just your heart that's affected. Obesity triggers chronic inflammation throughout your body. It decreases levels of something called natriuretic peptide, which is actually a protective factor against heart problems. At the same time, it elevates inflammatory markers with names like interleukin-6, C-reactive protein, and tumor necrosis factor. These create additional strain on your cardiovascular system while making your body more resistant to insulin and increasing your risk for serious cardiovascular events. Let's talk about something that might hit close to home for many of you: how obesity affects your day-to-day functioning and mobility. As we get older, maintaining our independence and ability to do the things we enjoy becomes increasingly important. Unfortunately, obesity can significantly impact your functional status and mobility, creating what researchers call a cycle of decreased activity and further weight gain. The relationship between obesity and disability is particularly pronounced in adults over 45. Obesity doesn't just increase your risk of becoming disabled initially, it also affects your ability to recover from disability if it occurs. This becomes increasingly complex as you age because the mechanical stress of carrying excess weight compounds the natural age-related decline in muscle mass and joint function that we all experience. There's a particularly concerning condition that affects many adults over 45, called sarcopenic obesity. This is when you have both sarcopenia, which is age-related muscle loss, and obesity at the same time. It's like getting hit with a double whammy. You have the metabolic disadvantages of carrying excess fat combined with the functional limitations that come with reduced muscle mass and strength. The inflammatory state caused by obesity has actually been linked to accelerated age-related muscle loss, creating a unique condition that significantly increases your risk of adverse health events. Research shows that obese older adults who experience falls have significantly altered walking patterns. They spend longer periods with both feet on the ground when walking, and their gait becomes more variable, indicating a loss of walking automaticity and increased instability. These changes create a higher risk for falls and related injuries, contributing to that cycle of functional decline I mentioned earlier. The impact of obesity extends beyond just physical health to affect cognitive function as well. The chronic inflammatory state associated with obesity has been linked to dysfunction in the blood vessels of the brain, which increases the production of beta amyloid. If that term sounds familiar, it's because beta amyloid is a key component of the senile plaques that accumulate in Alzheimer's disease. This connection suggests that obesity may actually accelerate cognitive decline and increase your risk of developing dementia as you age. From a practical standpoint, healthcare costs for obese adults over 45 are significantly higher than for older adults with normal weight. The complexity of managing multiple chronic conditions when obesity is present creates treatment challenges because obesity often serves as a marker of poor outcomes for most medical interventions and can interfere with the management of other chronic diseases. Now, I don't want to paint a completely bleak picture here because there's actually a lot you can do to prevent and manage obesity regardless of your age. Let's talk about prevention strategies that work. Effective obesity prevention requires what researchers call a multifaceted approach. This means addressing dietary patterns, physical activity levels, and environmental factors that contribute to weight gain. The Harvard School of Public Health emphasizes that prevention strategies need to go beyond just individual choices to include changes in our communities, schools, businesses, and government policies. But individual and family-level strategies remain crucial, especially for adults approaching or over 45. Let's start with nutrition, which forms the foundation of obesity prevention. The focus should be on consuming nutrient-dense foods while limiting calorie-dense options. This means increasing your consumption of vegetables, whether fresh or frozen, whole fruits, healthy protein sources, including both plant proteins and lean animal proteins, whole grains, and healthy fats like olive oil and avocado oil. On the flip side, you should limit sugar-sweetened beverages, processed foods that are high in added sugars, and unhealthy fats, refined grains, and foods with high sodium content. I know this might sound like common sense, but the key is making these changes sustainable rather than viewing them as a temporary diet. The concept of healthy home habits provides a practical framework that you can implement starting today. These include focusing on adequate nutrition, reducing sugar intake, decreasing fast food consumption, maintaining recommended activity levels, and limiting exposure to unhealthy stressors. Research shows that unhealthy behaviors often begin early in life and can have lasting impacts on adult weight status. But it's never too late to establish healthier habits. Physical activity is absolutely crucial for obesity prevention, and the benefits extend far beyond just weight management. Regular physical activity improves your cardiovascular and metabolic health, reduces your risk of high blood pressure and anxiety, and can even decrease your cancer risk. For adults over 45, physical activity recommendations focus on getting at least 150 minutes per week of moderate intensity aerobic activity. This could be brisk walking, cycling, swimming, or any activity that gets your heart rate up, but still allows you to carry on a conversation. Additionally, you should include strength training exercises to maintain muscle mass, which becomes increasingly important as we age. The relationship between physical activity and obesity prevention becomes particularly important when we consider preventing sarcopenic obesity, that double whammy condition I mentioned earlier. Current research shows significant benefits of physical activity and fitness in preventing sarcopenic obesity in older adults. Exercise programs designed to maintain both cardiovascular health and muscle mass show great promise for comprehensive obesity prevention. Here's the key. Physical activity programs should emphasize sustainability and enjoyment rather than short-term weight loss goals. For adults over 45, this approach is particularly important because it promotes long-term adherence and addresses the age-related decline in physical activity that often contributes to weight gain. The focus should be on promoting positive lifestyle choices and habits that you can maintain throughout the aging process. Environmental and social factors play a huge role too. The CDC emphasizes that obesity prevention requires coordinated efforts across multiple sectors of society. This includes studying community-based interventions, monitoring obesity trends, developing dietary and physical activity guidelines, and supporting programs that promote healthy eating and physical activity. Community-level interventions focus on improving access to healthy, affordable foods and safe, convenient places for physical activity. For adults over 45, these environmental factors become increasingly important as mobility limitations and fixed incomes may create additional barriers to healthy lifestyle choices. Now, let's talk about treatment options for those who are already dealing with obesity. The good news is that there are effective, evidence-based approaches available. Comprehensive obesity treatment begins with behavioral interventions that address diet, physical activity, and behavioral modification strategies. The Endocrine Society recommends that diet, exercise, and behavioral modifications be included in all obesity management approaches for individuals with a BMI of 25 or higher. These interventions typically involve multi-component programs with at least 14 sessions over 6 months to promote sustainable lifestyle changes. Effective programs include weight self-monitoring, dietary and physical activity counseling, problem-solving strategies, and regular feedback and support. These behavioral programs typically achieve 5% to 10% weight loss, which might not sound like a lot, but it can have significant health benefits. However, it's important to understand that weight regain occurs in 25% or more of participants at 2-year follow-up, highlighting the chronic nature of obesity and the need for long-term management strategies. For some individuals, medication can be an important part of the treatment plan. Anti-obesity medications are recommended for individuals with a BMI of 27 or higher with other health conditions, or BMI over 30, and they're used alongside behavioral modifications, not as standalone treatments. There are currently 6 medications approved by the FDA for long-term obesity management. These include GLP-1 agonists like semaglutide and liraglutide, tirzepatide, phentermine topiramate, naltrexone bupropion, and orlistat. Among these options, tirzepatide shows the greatest effectiveness, achieving an average weight loss of 21% at 72 weeks. The effectiveness of weight loss medications is evaluated every 3 months. If you're achieving 5% or more body weight loss and tolerating the medication well, continuation is recommended. If you're experiencing less than 5% weight loss at 3 months, or having side effects, your doctor will likely recommend discontinuing the medication and considering other options. For individuals with severe obesity, bariatric surgery represents the most effective long-term treatment option. Weight loss typically ranges from 25% to 30% at 12 months following procedures like laparoscopic sleeve gastrectomy and gastric bypass. Surgical interventions are primarily recommended for individuals with a BMI of 35, with other health conditions, or BMI over 40, though consideration may be given to patients with lower BMI depending on their overall health status. There are also less invasive endoscopic procedures that offer intermediate options between medications and surgery. These include procedures like intragastric balloon placement and endoscopic sleeve gastroplasty, which can achieve 10% to 13% weight loss at 6 months. As we wrap up today's discussion, I want to emphasize that obesity is a complex, chronic medical condition that significantly impacts adults over 45 through increased cardiovascular risk, functional limitations, and reduced quality of life. But here's the important takeaway. This condition's complex nature means that effective prevention and treatment require a comprehensive approach. Prevention strategies must address dietary patterns, physical activity, and environmental factors. Treatment approaches need to be individualized based on your BMI, other health conditions, and personal preferences. Effective management combines behavioral interventions with pharmacological options, when appropriate, and surgical procedures for severe cases when indicated. Long-term success depends on sustained lifestyle modifications and ongoing medical support. The growing recognition of obesity as a medical disease rather than simply a lifestyle choice has improved treatment approaches and reduced stigma, though continued research and policy development remain essential for addressing this global health challenge effectively. Remember, if you're over 45 and struggling with weight, you're not alone and you're not without options. The key is to work with your healthcare provider to develop a comprehensive plan that's right for your individual situation. Small, sustainable changes can lead to significant health improvements over time. Thank you for watching today's video. If you found this information helpful, please give it a thumbs up and subscribe to our channel for more health-focused content. Leave a comment below if you have questions or topics you'd like us to cover in future videos. Until next time, take care of yourselves and remember, it's never too late to make positive changes for your health.